Hello, my Red Tribe, and welcome to another episode of Dr. Red Diaries. So we're going to be starting a new series. I'm talking about health policies. For me, health policy is something that I'm passionate about, and I believe that a lot of us need to understand what we can assess in the healthcare system. We need to understand what health policy is all about, how it affects us. So for today's episode, we'll be talking about something very important. Most people know it as health insurance, HMO, however you know it. It's a very important topic and is one that is quite frustrating for a lot of Nigerians. I currently work with a HMO company or with a health insurance company, and I've been in health insurance for some years now, and I feel like I have somewhat of an experience and some information that I've really researched on and learned about health insurance that I think everybody needs to know. So if you're interested, just sit back, relax, and enjoy the episode. So we hear about these words: health insurance, HMO, NHIS, or now it's called NHIA, that's the National Health Insurance Authority. Before it was called National Health Insurance Scheme. So most people wonder, okay, is that what it's all about? How does it benefit me? Or some people say, oh, I don't enjoy my HMO, or HMO is a scam. I've heard so many things when it comes to health insurance or HMO in Nigeria. But based off of my several interactions with so many people, be it my clients, be it people under a particular plan, friends and family, I've realized that a lot of people don't either understand what health insurance is all about, especially in Nigeria, don't understand their benefits, their coverage, things they can access, things they cannot access, and how it benefits them. Because for me, I think health insurance, HMO, is very, very important and is needed. It would save a lot of lives. It would really go a long way in really helping, especially with cost of care and even with our current healthcare system. All right, let me paint a very familiar picture for you. So let's call the lady Chioma, for example. So Chioma she bought HMO plan, and then she bought HMO plan, and to her understanding or best of knowledge, she thinks that HMO plan covers everything, any medical care she wants to access. The HMO plan that she got covers for it. So she falls ill, she goes to the hospital, goes through the process, and then maybe after seeing the doctor, they take her to run some investigations, or they tell her to run some investigations. She goes to the lab and then she's told that, oh, some tests are not covered. She goes to the pharmacy, so medications are not covered. And then it's not covered by the HMO, by your HMO, or whatever it is, or the HMO will not cover this plan, or the HMO will not cover this test, the HMO will not cover this medication, or whatever information it gives her regarding non-coverage of the care she wants to access. She goes back, she's angry, she starts ranting, complaining that, oh, her HMO is bad, her HMO doesn't work for her, health insurance is a scam, and so on and so forth. With this short information I've just shared, there are so many layers to it, which I'm going to now explain in details. Before I even talk about that story I just shared some minutes ago, I want to now piggyback a little bit and really explain some basics when it comes to health insurance in Nigeria. Currently, we have less than 10% of people that have coverage under health insurance. Even though in the National Health Insurance Authority policy that was released, a new reform that was released in 2022 that spoke about universal health coverage. That is one of the things we're trying to achieve currently in Nigeria. We still have less than 10%. About 21 million people, and I think it was even less than that, are currently covered under a health insurance plan. And those 21 million people is because either it's covered by their company, by an association, a cooperative, or they got the government health insurance plan, maybe for their family or for their friends. That's the reason why it summed up to that amount, 21 million people. And that's even less than 10% of the Nigerian population. That's how low it is. So now we have the government health insurance. We have the private health insurance. So I'm going to give you the difference. The first one, government health insurance, is the one that we call the NHIA or NHIS. Most people still call it NHIS. We call the NHIS or the NHIA. And then the private health insurance is what we call the private HMO. That's what they call it, private HMO. For the NHIA and the NHIS, who can access it? Every Nigerian. Every Nigerian can access National Health Insurance Authority's plan. And the NHIA has so many plans. They even have a plan that is somewhat coined into the private sector called the Lira Eco. Most people have heard about it. Then they have the what I call it, the government funded, sort of. When I mean government funded, rather government subsidized, not funded, government subsidized HMO plan under the National Health Insurance Scheme. And then we have the private HMO. Who can access that private HMO plans? Every Nigerian can access the private HMO plan. So there is no specific plan for government workers. There's no, when I mean specific plan, I mean it's mandatory for people that work with the government to just get only the National Health Insurance plan. They can also get the private plan. Health insurance, or HMO in general, is called managed care. I think this, what I just said, is important for every Nigerian to know about it. It is managed care. It means that the plan or the scheme is created to manage the care of a particular person. That is one of the main reasons why not all care is covered under health insurance. And this is not subject to Nigeria alone. This is a universal policy, a worldwide policy. If you live outside of Nigeria, for example, there are still some medical treatments, some medical conditions, some medications, some investigations, some tests that would not be covered under the health insurance plan or the health insurance scheme. It is very, very important to take note of that, so that when you're buying an HMO plan, and then even if you feel you spent a lot of money, you're paying premiums, it's called premiums, every year for either the government or the private HMO plan. And when you want to access one particular care, they tell you it's not covered. You now go back and say it is scam. No. So it is important to have that, first of all, at the top of your mind, that when you're getting a HMO plan, it is for managed care, to manage care, not to cover all medical conditions in this world. Okay, so let's be very honest here. HMO is, for me, from my own opinion and general view, HMO is very important and it is very helpful. However, it is limited. Limited because, like what I said earlier, it is managed care. But it goes a long way in really providing or helping or aiding in reduction of out-of-pocket payments or expenses that someone can incur in the hospital. So what are some of the things that some HMO plan would maybe cover? I'll just talk about some basic things now. In that episode, I will delve deep into some benefits and some things that I think most people can really benefit and enjoy from HMO plans. So HMO plans majorly cover basic consultation, common illnesses, some investigations, but not really limited, not all investigations, but even some comprehensive investigations. Some HMO plans actually cover that. Specialist care, surgeries, optical and dental care, medications, and a host of things. And HMO plan, most of the time, comes in different packages. What I mean different packages? We call them premiums. We call HMO payment premiums. And they come in different packages. So you can pay HMO monthly. Some organizations accept monthly. Some organizations accept quarterly, biannually, or annually. You can make that payment. And even the government HMO plan, they actually accept annually, and I think they accept biannual payment also. So most people would want to find out, okay, in comparison to government and private HMO plan, which is better? This is my honest opinion about both. The truth is, in general, most benefits are the same. For the government health insurance plans, they've really gone ahead to really expand and include and increase some of these benefits that some Nigerians can easily access and get benefits to. While for private HMO, it's made in such a way to cater to your pockets. So what you feel you can afford, maybe monthly or quarterly or yearly, for example, there is a plan for it. That's the reason why some private HMO plans can be customized. But for government HMO plan, it is standard, it is generic. They have one plan. It cannot be customized. So that plan is what you're going to be paying for. The plan covers a lot of things. I may not be able to go in details and share what the government HMO plan would cover, but if you're interested, let me know. Maybe I will do like a detailed episode of what a government HMO plan covers and what most private HMO plan covers, and then we'll see in comparison. So that's it when it comes to the coverage. All right, so let me talk about quickly what are some of the challenges that we're currently facing when it comes to health insurance in Nigeria. Number one is lack of awareness. Lack of awareness when it comes to how HMO works. Lack of awareness when it comes to the benefit that you've chosen to buy. Lack of awareness and understanding of the benefit you've chosen to buy. And also lack of trust. And also, I'm going to be honest, the truth is, we are still working on our regulation when it comes to regulating both the private HMO, the government HMO, those hospitals, on how they provide care and services to Nigerians, provide care and services to the citizens. Another challenge or another setback we're currently dealing with is the relationship between the hospitals and the HMOs. It is an ongoing challenge, an ongoing problem, particularly when it comes with payment, building trust, building relationships. Sometimes hospitals feel that the HMO is trying to cheat them or shortchange them. Sometimes the HMO feels like the hospital is trying to shortchange them or cheat them. Those are some of the reasons why most people have issues or still think that health insurance is a scam, or they don't even trust the health insurance system. They don't trust HMO in Nigeria. They don't think HMO is beneficial to them. They don't think it's working. They don't see even the reason for them to buy an HMO plan. So in the next episode, I'll be talking about some benefits of health insurance, getting an HMO plan, and the reason why I think every Nigerian should have a health insurance plan.